course, anytime you use the word hope around the Department of Human Services, you get lots of people raising their hand and bright smiling looks, because we are very much invested in the science of hope, and I'll talk here in a minute about that. But this concept of hope through the lens of helping Oklahomans partner everywhere resonated so deeply with me because of some other work that we're doing. Again, I'll jump in on that. The work that I'm talking about and referring to really all ties back to this process that we built when I came into the agency. So I've been with the agency about 22 months now. As the director of the Department of Human Services. June of 2019 was my first month. And then in March of 2020, the governor duly appointed me as Cabinet Secretary for Human Services, and thankful to be in that role because I'm also involved with 6 other agencies and then another 30 or so boards and commissions in the state. But when I came into the Department of Human Services in June of 19, we built this process called Finding Our True North. And lots of times, and even for many months after we sort of launched it, it just sort of landed like corporate speak, slogans and that sort of stuff that really didn't drive the work that we're doing. But now, as it has matured in the agency over the last almost 2 years, it is very clear to the workforce and to those that we serve alongside, partners in the community specifically, that this True North concept is really core to who we are now and to our DNA. So I'll talk a little bit about that process, and then I'm going to specifically mention 2 of our executive leadership True North strategies that tie directly to this concept of hope and helping Oklahomans partner everywhere. So we started the process immediately upon me coming in, and I sat down with the division director. So we run 6 program divisions for the state of Oklahoma. And so those are, child welfare, adult and family services, which is the social safety net, developmental disability services. Of course, you all know that one, child support, child care, aging, and adult protective services. And so those are our 6 program divisions. They do wildly different things for citizens in the state of Oklahoma, but are all aligned in their commitment and compassion to care for people, and sometimes the most vulnerable people in our community. So we built this process called Finding Our True North. I sat down and I said, so tell me, what are the things that you do in your division that truly drive value for the people that you're serving? Not value for the agency or for the workforce, but for the people at the end of the day. And so each of those divisions came back with 25, 30, 35 different things that they do that drives value. And I said, listen, if everything's important, nothing's important. We've got to refine our approach in each of these divisions to come up with these really these true sort of compass needles, the direction to define the direction that we're heading. Candidly, also to make sure that we're spending our limited resources, financial and manpower resources, in the ways that truly, build value for the people that we serve. So they went back to the drawing board, and each of those divisions came back with 3 to 5 True North philosophies. And those are all online. I'm not going to walk through all 30 or whatever those are, however many there are. But they're online, ourokdhs.org. Please feel free to jump on and see those. But then our leadership team, probably the top 25 or so folks in the agency, sat down and we said, okay, these divisions are doing such great work in the divisions. What are we as a team going to do to support them from an agency perspective and being able to accomplish their work? So we came up with 8 executive leadership True North philosophies. And those are truly the sort of, again, those compass needles that we live by every day. In fact, in every budget conversation and every strategy discussion, we always ask the question, how is this impacted by our True North? Are we truly aligned with the things that we say are important to us? So I wanted to highlight, I'm going to run through really quickly all of the 8 executive leadership True Norths. Then I'm going to highlight 2 in particular, because those are those that most connect, I think, with the work that you all are going to do today. So the first 2 are actually the ones I'm going to highlight the most. They're the most. So I'm going to start with number 3. Number 3 is becoming an elite employer. I do believe that if you have a passion for serving our community, there should be nowhere you would rather work than the Department of Human Services. It isn't the case today, although I think we're getting there. And in fact, it's an amazing honor to me to know the people that I work alongside, that they have stuck with our agency over the decades and generations, because in many times it's been a hard place to work. So we're trying to remove those barriers. The people that work here are so incredibly committed to the work that they've stuck with us, but now we need to make it a better place to work. The fourth is number four is becoming a model of efficiency, effectiveness, and transparency. I hope that those of you who engage with our agency see that on a regular basis. We are consistently recognized as a transparent organization. We own our faults and our flaws, and we work to solve those. We're working to build a much more efficient, effective organization so that I can walk across the lawn to the Capitol and say, listen, I know that our dollars are spent effectively and efficiently, and now here are 10 ways we can invest in the people of the state of Oklahoma, so I need more. So I'm not saying we're not there yet. I'm saying I can't say that. We're rebuilding our full finance team. We have a fantastic new CFO, and we're trying to build some technology that will help us to truly share that we are efficient and effective. The fifth one is becoming a space of innovation, where we are a self-correcting agency, a national thought leader and program innovator. We're definitely getting there in lots of spaces. Number six is telling our story. Honestly, 24 months ago, my impression of this agency was what I saw in the evening news. And the truth behind what happens in the walls of the Department of Human Services is 180 degrees different than what happens, than what is shown on the 10 o'clock news. So for every bad story, there are 1,000 incredible stories that we have just stunk at telling those stories. So we're gonna retell our story. Number seven is building a culture of equity, diversity, inclusion, and belonging. I think we have a unique opportunity in this agency that nobody else in the state has, in that we have the 8th largest workforce of any public or private organization with 6,300 employees. We serve about 1.5 million Oklahomans a year, about a third of the state's population. So we have a real opportunity to develop a culture of equity, diversity, inclusion, and belonging. And then number 8 is moving upstream to solve problems for families before they become in crisis. So really meeting our customers where they are to solve for primarily poverty in the space that we're working on. We investigate 80,000 cases of abuse and neglect against kids, and another 22,000 cases of abuse, neglect, and exploitation amongst seniors every year. And it's important in those 80,000 cases to point out that 90% of those are neglect, not abuse, and 70% of those are related to poverty. So a huge chunk of the calls we get to child welfare are poverty related. So if we can move upstream and solve problems for families before they become in crisis, we believe we can never know families through the child welfare system, and that's the direction we're heading. So those are numbers 3 through 8. I'm going to go back and I'm going to talk for a minute about numbers 1 and 2. The first one is to become the largest ever hope-centered organization. Again, I said when I started that anytime you mention the word hope here at the Department of Human Services, you get people light up. You could probably see it happen just there in me. It is important to make sure people understand that hope is a science. It is measurable. It is not the same as a wish. A wish is the belief that tomorrow can be better, but hope is then when you add the phrase, and I can do something about it. So hope is the belief I can do something, or the tomorrow can be better than today. The future is better, and I can do something about it. I have control of my own destiny. So we are very close to Dr. Chan Hellman, who's one of the leading researchers in the entire world around the science of hope. It is measurable, and we can impact hope. A child's hope score is based on 36 points, and a 2-point increase in that hope score results in a letter grade improvement in school. So by building hope in the people that we serve, we are improving their lives. And that's what our agency is, what we do, and what we will do going forward. So hope has 3 primary components. The first is goal setting, where I can see that there is a future that I want that is better than today. I can see that future. It is my goal. The second is a pathway, that there is a way for me to get to where I am today to that goal. That's that pathway. So the creation of that, and in many cases, the Department of Human Services is that pathway. We provide resources that help people to see that there is a way to get from where I am to where I want to go. And then the third component is agency or willpower. that I have that within me, that I'm not going to stop. I'm fully committed to taking that pathway and getting from where I am to where I want to go. So that's really the science of hope. Again, we can measure it and we can move forward. And we are the pathways in many cases for people in the community. The second, which really connects to the work that you all are, I believe, are going to do today in this conference, is removing systemic barriers that keep our customers from being successful and accessing resources and services. So we all know about those barriers. We hear about them all the time. Those are transportation barriers, or language barriers, or technology barriers. In many cases, we require you to show up at a Department of Human Services location where we attempt to serve you. And then if something doesn't go right, we require you to go to another building where they need to serve you first. It's essentially getting in line somewhere else. But in the meantime, you've had to take time off of work, or you've had to find somebody to care for your child, or you've had to, whatever, you've had to find a way to get there. In many cases, folks don't have the transportation they need to keep continuing to go to different places. So our goal as an agency, and this is probably the most foundational of all of the goals in regards to the actual mechanics of what we're doing, is removing those barriers. So we started by talking a lot, and we continue to do so with our agency partners and other agencies, about co-locating, bringing services together so that we can meet people's needs in one place. And then about a year ago, we decided to really completely change the distribution model for human services. And we are deep into that work now. The primary effort there is called a multi-channel embedded worker strategy. So we as an agency had 92 buildings spread out across the state of Oklahoma, 6,300 employees, an incredible workforce who's committed to serving. But in many cases, we were handcuffed to the buildings. So we had a 30,000 square foot building somewhere that said Department of Human Services on the side of it. But in order for that model wasn't built around our customers. So in order for somebody to access services, they had to fall to a level of despair to reach out to the Department of Human Services and show up in a county office somewhere and receive those services. So our intent is to remove ourselves from the buildings and embed ourselves in the community. So we are already somewhere between 200 and 300 embedded workers spread across the state. Those are places like homeless shelters and hospitals and schools, and really meeting our customers, meeting the people that we serve where they are. And then we also have other really intentional efforts that we're developing to do so even more. We've got to remove ourselves from the comfy confines of our cubicles and really meet people where they are so we can serve them. So we are also building, and we already have 5 or 6, I believe, social work teams embedded in law enforcement offices, really starting here in central Oklahoma, but intending to spread out so that when a law enforcement officer meets someone in the community and a firearm is not necessary, they have a social work team that they can call to deploy and solve problems around poverty and mental health and those situations. So that's another example. We are now the leader of the Front Porch Initiative, where our workforce is being trained, and our what we call front porch ambassadors are being trained on all of the other agency resources that are available. So you meet one person and you can get SNAP, and you can get Advantage services, but you can also get a driver's license, and they can help to facilitate all of those needs in one place. The coolest example, I mean, there's so many great examples, but there's a really neat example of one of those places of how we're changing the distribution model is our Hope Centers, community Hope Centers. So we started as a response to COVID-19 and schools closing and those systems being removed from the lives of our kids and families, standing up what we call community Hope Centers, which is us wrapping resources around existing providers like Boys and Girls Clubs and urban leagues and YMCAs to really build out the services that they can provide. So now in a community Hope Center, a child can engage with the Boys and Girls Club and get the incredible, robust programming that the Boys and Girls Clubs provide. They can also get access to mental health services and for food, 2 meals a day, weekend backpack programs, those sorts of things. When schools were closed, there was educational assistance, getting kids on learning platforms. We're looking at health programs and parenting and family building classes all in one place. One of the magic components to this around our multi-channel embedded worker strategies in a Hope Center, if it's a YMCA or a Boys and Girls Club, there's also an embedded DHS worker. So that when the child engages with that Boys and Girls Club programming, we can serve the systemic needs of the family. Sign up that family for anything you're eligible around those programs, SNAP and housing vouchers and whatever the family needs. So we're really serving the whole family in one place. So we're extremely excited. I actually went to the governor on July the 27th and asked for CARES Act funding for that. He gave us $15 million of the state's CARES Act allocation, and 52 Hope Centers across the state serving more than 3,000 kids and families between August and December. So really pretty incredible in the way that we work there. The future is an expansion of the Hope Center strategy around workforce, around health and mental health, partnering instead of youth development focused partners like Boys and Girls Clubs, plugging in partners like hospitals and places where there are poor health outcomes, and career techs when there are places that need workforce retraining. Maybe there's been an economic issue like the economic fallout from COVID-19. We can now build these Hope Centers and wrap resources like childcare and food and housing resources and health and mental health around those families where they are getting workforce training programs. So I'm hopeful that all of that, the illustration of our executive leadership True North strategies, as well as a deeper conversation around hope and removing systemic barriers, resonates with you all today as you talk about this concept of hope through the Oklahoma Family Network and helping Oklahomans partner everywhere. It takes all of us to do this work. We are an agency of 6,000 employees serving 1.5 million Oklahomans this year. The math doesn't work. We cannot do it alone. You cannot do it alone in the work that you're doing with your child or in your community. And we need to help one another. So if I can leave you with any parting message, one is if you find a way for us to help you, please reach out. That's what we're here for. We are trying to remove the walls around the agency so that we are just a part of the community. But secondly, if there's a way for you to help your neighbor, or if you need help, people are there to partner with you to serve your needs and your family's needs. And this state has to do it together. So with that, I think I've achieved my time frame and I've hit the points I've wanted to. I'm super thankful to be with all of you all today and thankful for your service in our community. So have a great time with the conference today.